Unfortunately, we asked you to come here because we have some news that is, we feel very sad and not good for the community, but unfortunately, after 11 years of providing services to the community, sheltering the poor and the homeless, we're going to have to close down October 1st because of a lack of community support. You know, you might wonder, well, how did we get here after 11 years? Unfortunately, there's a lot of misinformation, just outright lies about who's on the street, what services we provide, and what ends up happening is that information gets circulated by sometimes people that are in positions of influence, even people in the city. And that gets recirculated to our donors, and we've had several of our donors that have heard this message from those people saying if the warming shelter was not here, the homeless problem would decrease dramatically. And so they have opted not to support us. So as our support went down, we were looking out into the winter time, which is the most dangerous time for the homeless, and we didn't believe that we would have sufficient funds to be able to go through the season. So by at least announcing that we're closing October 1st, that is giving other agencies the opportunity to start planning for how they're going to handle the people that we had been serving in the past. The shelter during the wintertime houses on the average of about 100 men, women, and children per night. And last year, in the most severe blizzard, we had 151 people here in the shelter. And those people are going to now need to find another place to be. The shortfall right now is about $500,000. And it's not just $500,000 for this year. What we had made a decision is if the shelter is truly going to be able to be part of the fabric of serving the poor and homeless in the community, we need 5-year commitments for the funding. And to this date, we're very disappointed because both the city and the county and area churches, not all of them, but some area churches support us, but there's 197 churches in the community, and we don't get the support that we need. And we try and use every penny as carefully as we can, but eventually it comes down to a point where it's not sustainable any longer. And when people are saying that we're the cause of the homelessness problem or issue in the city, then we get vilified. And I think if you talk to other area agencies, they would tell you, we're the ones that take people who have no hope and we give them hope. And once you have hope, then you believe that you can turn your life around. And we have many, many success stories, don't we?
Absolutely, yes.
I mean, do you ever want to share a couple of those?
Yeah, I mean, we've had several success stories over the time that I've been here. We have housed several families just as of this past month, you know, working with other services and resources in the area. We have 2 individuals who actually used to stay with us who are now employed by us, and they are doing incredible, and they are very dedicated to serving the homeless community because they've been there and they've experienced it themselves. Most of our staff members, not all, but a good portion of them have lived experience, which means they've been homeless before. And so the group that we have right now has been able to help our clients and our residents more than we've ever been able to before. We've made these connections with other area resources and been able to get people housed that most would determine we're not able to be housed. And so we've had some of the toughest cases, and we've actually been able to get them into their own stable living situation where they can sustain it and be happy and healthy and, you know, in their own home, no longer staying with us. So there's many of those stories, and I could go on, but without asking permission, I won't give any names. But I do know there's so many people who are very, very thankful for the services that they received while staying with us.
We've provided over 150,000 nights of shelter since we've been open, and over 110,000 days of shelter. What's going to end up happening with us closing, one of the things is there are no public restrooms in downtown or public drinking fountains other than in the library and City Hall. And when they close on weekends or when there's a blizzard, there's no place for people to get a drink, to use the bathroom. If you want to get apply for an apartment or apply for a job, you need to have computer access. Well, the only free computer access is over at the library, unless you come here. We provide free computer access so that they're able to try and get a place to live, get a job to work so that they can move on to a better life. The police, we take people who have substance abuse issues, and some of whom are intoxicated, and the police could bring those individuals to us in that condition, and we would house them here. If you talk to the police department and the county sheriff, the cost of, if you've got a person with a public intox arrest, the time for the expense for a cruiser is about $132 for an hour, and that's about $100 for them to go to jail. So every public intox that they pick up, it's costing $232 at a minimum, and that's at the current jail. When the new jail opens out by the landfill, it's going to take even longer, and it's going to take cruisers off of the street, and it's going to cost people even more. The emergency room, that's another thing. You know, we work with Community Health Center, and Community Health Center and street medicine comes here. A lot of our residents have not taken the best care of their health, and therefore they have issues, medical issues. Well, they're able to be treated in some cases right here. When we close, they're going to have to go to the emergency room or community health or other places that they're going to have to pick up the slack that we have been covering. And so sadly, other communities, Sioux Falls, their government gives $120,000, city government gives $120,000 a year, and they're jumping to $140,000. And Omaha provides similar levels of support to their shelters down there, and I think if you look at the other communities in Iowa, you're going to find that level of support. Churches, a lot of the churches in other communities provide significant financial support, and while we've received some support, it's been very minimal. So I guess, is there anything that you'd like to add?
Just to kind of piggyback off of what Joe said about the emergency room and first responders and that sort of thing, not only will our residents, when we close, be going there for, you know, their medical care, but as human beings, we have needs, basic human needs to stay alive, and in those terrible winter months, they're going to be going to those places to seek shelter. I know firsthand, I work in the hospitals, and I know firsthand that it's already busy. And so I can only imagine that as these winter months take place, that they'll be even busier, and it's going to put a toll on many of our first responders and our nurses and doctors in those ERs. So that's just, you know, something I find really important, just because if I go to the hospital, I want, you know, my child to be treated right away. But if they're flooded with, you know, people that are needing help for other reasons, you know, we won't get that help as quickly. So,
If I could add just a couple misconceptions that are out there, you know, this idea that the warming shelter acts as a magnet to draw people to the community. If you talk to not just the folks at our shelter, but the other people that provide shelter in the community, approximately 80% of the people were born or raised here in Siouxland. So when we close or a shelter closes, where are they going to go? They're not going to go to some other city. They're not going to just disappear. They're going to stay where the remnants of their family might be, or the people that they went to school with. And people are able to say, oh, well, that's them. But when it becomes personal, when you realize that everybody that we house, they were somebody's son or daughter or aunt or uncle or somebody you graduated high school with, it's just so sad that they're able to distance people and make them not be a brother or sister that we have a responsibility for. In the last 11 years that we've been open, to the best of our knowledge, checking records, there has been no one that has died, no homeless person that has died from exposure. Even though for the years before that, if you check the records, there were usually a couple people a year that would be found frozen to death in our community. And there's a high probability that that will happen again, because we're not going to be there to serve them.